come in.
My name is Ethan Boborowski. I'll be your student nurse for today. The doctor's ordered a physical assessment. Can you give me your full name and date of birth?
Steve Martin,
Okay, date of birth.
July 1st, 1972.
Okay, let me check your wristband. Okay, matches that. Let me provide hand hygiene, some privacy as well, and I have all my equipment, so I'll begin. We're just going to go through a few systems. First, starting with head and face. Do you have any facial drooping of any kind?
No.
Okay. And your face looks normocephalic, looks symmetrical. Are you having any pain as well?
In the face area?
Or just in general?
In general, no.
Okay. Next we'll move on to ears. Do you have any trouble hearing?
I wear hearing aids.
Hearing aids, okay. Next we'll do the whisper test to just test hearing and everything. So I'm going to stand arm's length away and just cover one ear. I'll whisper a 3-syllable word and then just repeat it to me, then cover the other ear and then repeat it as well.
Okay.
Okay, cover one ear. The sky is blue. And repeat that.
I didn't hear it.
The sky is blue. The sky is blue.
Yeah, I wear hearing aids. I didn't hear that one.
Okay, and then cover the other ear. The sky is blue.
Yeah, I didn't hear that one.
Okay, hearing aids.
Yeah.
Okay, it's fine.
What word did you say?
The sky is blue.
Oh.
Okay, hearing aids, so that matches what you stated. Next we'll do the eyes. Do you have any problem with vision or anything?
No.
Okay. Next we'll do the pupillary light response. So I'll have my light and I'll shine it into your eye. I'm going to look for direct and then consensual response. And then I'll do accommodation, or I'll look for your eyes constricting, getting closer. So first I'll start with direct. So I'll just shine this in your eye. Okay, and again. Okay, just direct and consensual. Then just follow the pen. I'll get closer. Okay. There's also constriction as well, or accommodation. So pupils are equal, they're round, reactive to light, and there's accommodation, which is good. And the size of your pupils are about 4 centimeters. Okay, next we'll do the nose. Do you have any drainage or anything coming from your nose?
No, I'm good on that.
Okay. And looking at your nose is midline. And next I'll do nostril patency. So cover one nostril, then breathe in. Is that clear?
Mm-hmm.
Okay, then cover the other, and same thing. Okay, they are patent, which is good. Next we'll move on to mouth, throat, and neck. Do you have any trouble swallowing? Can you swallow for me? Okay. Let me also look at your inside of your mouth. I'll look for your oral mucosa and your teeth as well. Okay. Mucosa is pink and moist. There doesn't seem to be any tooth decay, which is good. I'm also going to look at your neck. Okay. Your trachea is midline, which is good. Next I'll move on to neurological. Who are you? Or you already stated that earlier.
Yeah, Steve Martin,
okay.
yeah.
And then where are you located right now?
I'm in the doctor's office.
Doctor's office, okay. What about time is it?
It's about 10:19.
10:19, okay. And why are you here, or what are you here for?
I'm here for a regular physical exam.
Okay. There seems to be times for consciousness and orientation, which is good. Next, I will explain the Glasgow Coma Scale. So it measures consciousness level after brain injury. And the different categories are eye-opening, verbal response, and then motor response, but you don't have any brain injury, so we don't have to check for that. Do you also have any memory loss of any sort as of late?
Mm-mm.
Okay. Next we'll move on to the respiratory portion. So first I will look at your respiratory rate. So just breathe normally for me. Okay. Respiratory rate seems to be normal. Doesn't seem to be any abnormal effort of breathing, and the pattern seems to be normal. and there's eupnea, which is good. Next, I'll listen to your breathing sounds in the 4 quadrants on your anterior, posterior, and the lateral sides. So I'll do that with the stethoscope directly on the skin.
Like pull my shirt up.
No, that's okay. Okay. Doing the correct pattern as well. Okay, seems to be normal. I'll do the same thing posteriorly. Okay. Same pattern. Okay, and I'll do it on the lateral side. And the 2 lobes. Then I'll do it on the other side as well. Okay. Okay, everything sounds normal. Normal pattern, or the correct pattern, and everything sounds good there. Next, I'll educate you on the turn, cough, and deep breathe technique. So this would be to remove sputum or any thing blocking your airway. So you would turn, you would then cough, or you would deep breathe to move up the sputum, then cough to get rid of it. So that will help breathing. Next, we'll do incentive spirometry, which is this. So you would breathe in, and then hold, and then hold that for 3 to 5 seconds, and then just breathe out. And if you have any sputum or anything, you would cough. You would do this 10 times in an hour, but not back to back or anything. So both of these would help you breathe and everything. I'll take that. And you don't have any sputum or anything or cough?
No.
Okay. No trouble breathing?
No.
Okay, next we'll move on to the cardiovascular portion. So first I'll assess your jugular venous pulse. So turn your head away from me, and normally we do this at a 30-degree angle, but in this case it's not. Okay, I'm just going to inspect. Okay, same thing, turn the other way, look on the other side. Okay. And it doesn't seem to be any distension, it's not bulging or anything, which is good. Next we'll move on to be palpating your pulses. So I'll do the radial, posterior tibial, and dorsalis pedis. I'll do this on both sides. Okay, I'll do it bilaterally. Okay, now I'll do the posterior tibial, which is behind your ankle at the bottom of your foot. And then your dorsalis pedis, which is on the top of your foot. Okay, they all have a strength of 2+, normal rhythm, nothing abnormal, which is good. Next, I'll explain the anatomical locations of your carotid, which is on the opposite side of your knee. Your carotid is on your neck, excuse me. Your popliteal is on the opposite side of your knee,
Okay.
right here. Your brachial, which is on the opposite side of your elbow, right here. Your femoral is in your groin area on both sides, and axillary, which is under your arm. Next, I'm going to assess capillary refill. So I'm going to squeeze your fingers on both sides bilaterally. Okay, that was 2 seconds, and then I'll do it on your toes bilaterally as well. Okay, those were 2 seconds, which is normal. Next, I will inspect and palpate for edema on your lower and upper extremities. So I'm just going to squeeze bilaterally. Okay, and same thing on your feet. Okay, no edema or anything, seem to be normal. You can move on. And was there any heart pain or anything?
No, that's pretty good.
Okay. Next, I'll listen to your heart sounds. I'll do your pulmonic, or aortic, pulmonic, herbs, tricuspid, and mitral. So I'll do aortic, pulmonic, herbs, tricuspid, and mitral. I'll also listen there for a minute for your apical pulse. Listen for the strength. Okay, that was a minute. It was a strength of 2+, and normal sinus rhythm as well, which is good. Nothing abnormal, and I use the diaphragm of the stethoscope, listening for higher sounds. And that, like the S1 and S2, which are the normal rhythms. I would use the bell for lower sounds or abnormal rhythms, such as S3 and S4, but I didn't hear any of those. Okay. And now And you said you had no chest pain or anything?
Mm-mm. No.
Okay. Next, I'll do the musculoskeletal. Do you have any trouble walking or anything?
No.
Okay. Next, I'll assess ROM, range of motion, on your upper extremity. So I'll do your elbow and then your wrists on both sides. So just bend normally. Okay, there's no popping or scraping or anything. Is there any pain?
No.
Okay, I'll do the other side. Same thing. Okay. I'll do wrists. So just bend like this for me. Okay, there's no popping, scraping or anything. Any pain?
Nope.
Okay. Next, I'll do the lower extremities. I'll do your knee and then your feet or your. Yeah, I'll do on your feet as well. So first, just bend your knees. Okay, no pop. There doesn't seem to be popping or scraping. Is there any pain?
No.
Okay. Same thing with your feet. Just bend them or flex them. Okay, no popping or scraping, and there doesn't seem to be pain or anything.
No.
Okay. Okay, good. The range of motion seems good, and then your upper and lower extremities. Next, we'll assess the gait and balance. So, for gait, would you just walk normally, just around, then come back? Okay, and then coming back. Okay, gait seems to be normal. Next, we'll do the Romberg test, doing for balance. So stand with your feet together and your hands at your side, and then close your eyes for 30 seconds. Okay, 30 seconds. Okay, you seem to be standing straight, which is good. Your balance seems good. Okay. Next, we'll do the Morse fall scale. So there's no history of falling or anything.
Nope.
Okay, there doesn't seem to be any secondary diagnosis. You don't have any ambulatory aid. You're walking fine. You don't have an IV. You're not using furniture to walk or anything.
No.
Okay, walking normally okay. Your mental status seems to be okay as well. And finally, I'll do some fall education. So when you're at home or in the hospital, don't use any furniture or anything to balance because it can't be safe.
Okay.
Watch for clutter on the ground or any loose rugs or anything so you don't fall. Keep good lighting so you can see any things on the ground or in your way.
Okay.
And just like loose cords and everything also keep out of the way so you don't have any falls or anything.
Okay.
Okay, I think that is everything.